All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. Today we're going to go over the VAERS system by CDC to see various vaccines. So in the US, we have Moderna, Pfizer, and now Janssen or Johnson and Johnson. I want to go over the CDC site and the adverse reactions that have been reported. Cool Beans had been asking about this for a long time. Many of them had become quite impatient now and saying, have you seen these adverse reactions? So I thought we'll do two things today. Number one, we'll look at some of these adverse reactions. And number two, we'll also see how to see the adverse reactions so you can run your own reports as well. So let's start our discussion and we'll go from there. So this is drbeen.com. And then here, there was an interesting, or rather, I think the whole day today in our discussion, we're going to be a little bit in a doom and gloom state. So please don't be in that state. However, the news is such, I mean, the things that we're doing are such today. So March 16, 2021, this is the AstraZeneca against the South African variant. And here is just a high level from the study results between June 24, so last year, June 24, and November 9, we enrolled 2,026 HIV negative adults, median age 30 years, 10, 10, and 10, 11 participants received at least one dose of placebo or vaccine. So this is very early time with the vaccines. Both the pseudovirus and the live virus neutralization assays showed greater resistance to B1351. So let's look at the results. In the primary endpoint analysis, mild to moderate COVID-19 developed in 23 of 717 placebo. So that was 3.2%. And in 19 of 750 vaccine recipients, that is 2.5%. For an efficacy of 21.9%. So sure, this is efficacy, but this is really not an efficacy to be valuable. The only thing that is interesting to see would be, were there any deaths? But of course, the size was small, and I don't think that there was any deaths that occur. I still have to look at that data. But if you see here, the incidence of serious adverse events was balanced between the vaccine and placebo group. That also means probably nothing, no difference. Among the 42 participants with COVID-19, so out of these 42, 39 cases, or 92.9%, were caused by B1351 variant. Vaccine efficacy against this variant, analyzed as a secondary endpoint, was 10.4%. So almost nothing. If it protected against the death, that is probably the only outcome of the vaccine then, but no efficacy. And this is June timeframe to November. This is not new. This is not now. This is just early on. Now the question is, what is the AstraZeneca's other reports that are coming in after the larger number of people have been vaccinated? I do not have that data, but I just wanted to quickly bring us up to speed with this news. Now let's start with our adverse reactions that are reported to CDC. So before we started the adverse reaction, here is the vaccine efficacy. This is Statista. And if you see here, this was original vaccine efficacy reported. And so Pfizer, BioNTech, and we'll talk about that today, they had reported their efficacy to be 95%. Then Moderna, they had reported their efficacy to be 94%. Then Sputnik is 92%, or Sputnik. And then Novavax, 89%. AstraZeneca, 70%. Here we have Johnson & Johnson, 66%, and Coronavac. So we are really concerned at this time for US, because I could only get the US data, is Pfizer, Moderna, and Johnson & Johnson. Here is the Bloomberg's vaccine tracker. I had to really go and search a lot to figure out exactly how many doses of Pfizer versus how many doses of Moderna and Johnson & Johnson that are administered, not delivered to the government or authorities to be administered, but the ones that have been administered. So that was a little difficult for me to find it. Maybe I was not looking in the right direction, but I was able to find from here and there and collect some data together. I'm going to show it to you. This is the vaccine VAERS system, or the vaccine efficacy or vaccine adverse reaction reporting system. So let's look at it. One thing that I wanted us to be aware, in this app, one can, after receiving the vaccine, one can go in and provide the report. It is not something that they would call in and ask you about. This is really reported by the patient. So if you see here, patients or persons who have received the vaccine. So read this note: submitting a report to VAERS does not mean that the healthcare personnel or the vaccine caused or contributed to the adverse event, or it is a possible side effect. What they're saying is, we are collecting the adverse reaction, but that doesn't mean vaccine did it, or the person who gave you the jab that did it. So that's just a note. But we are still going to do the analysis because this is the only thing to do analysis on. And all of these links are present in the description. This is Johnson CDC about Johnson & Johnson. So if you go to CDC, again, the link is in the description. Here, the vaccines that are being administered: Pfizer, Moderna, Johnson & Johnson. This is CDC's little pamphlets about them. Nothing very useful, but still it's there. This is Moderna's press releases. And if you see their latest press releases, is if you look at it, March 16, Moderna announces first participants dosed in phase 2-3 study of COVID-19 vaccine candidates in pediatric population. So Moderna has actually started testing it on children. Then this is the site, I think, where I got the news for here. So I think this is 10th March, so a few days ago. With over 47 million doses of the Moderna vaccine administered to Americans, we are getting a clear picture. So from here, total 110 million doses are given at this time. 47 million of Moderna. Remember, Pfizer had started before, so probably a larger number than 47 million. And I found somewhere over here for Johnson & Johnson, and that was, if you see here, Johnson & Johnson, 458,000 doses. So the rest are with Pfizer. So I kind of used these calculations to figure out what are the exact numbers. I did not find any one place. So with this context, now let's start looking into the VAERS system. So if you go to VAERS, so let's say this is their main page. When you go to their page, first of all, they would ask you to agree to their terms and conditions. So whatever, we'll agree to it. Then the second thing is to now be able to run the reports. So what I'm going to do is over here, so you can run the reports in two ways. One is just to see the symptoms, or the other one is to actually read the report by individual patients. So if we, and again, this is anonymized. So let's say, for example, we want to read the report for the individual patients, and then I'm going to do vaccine manufacturer. And then if you want to read the report, you have to select VAERS ID. So I've done that. And then down here, I'm going to search for, let's say, Anaphylaxis. And then I click search here. So now there are multiple reasons for the anaphylaxis over here. I'm going to actually go back here and look at this. So if there are multiple ways that anaphylaxis may have been reported, for example, allergic reaction, anaphylaxis, breathing, wheezing, they would have that list over here. So for us, it is anaphylaxis. So I am just clicking that. Then down here is the further what kind of a vaccine you are looking this reaction for. So I'm going to select COVID-19. Then what manufacturer? So if you do not select a manufacturer, then they are going to roll up all of manufacturers' anaphylaxis together in one number. So let's first see what is the total number. So I'm not going to do any changes here. And if I now go down here and say send, they are now processing. Okay, so I had selected, give me 1 second. I had selected by VAERS ID, so I'm going to say none, just so that I can get a total number first. So here, this is the Moderna 85 cases of anaphylaxis and Pfizer-BioNTech 170. So if I go here to my illustrations, check this out, that we have about 110-11 million doses. There are 72.1 million single shots given, about quarter of the US population. 39 million folks have received both shots, so about 12%. Total population of the US in 2020, I believe, this is 2021, 2020, 331 million. The plan that the administration has is that by the end of March, 130 million doses will be available to be given. And then by end of May, 300 million, or all the population. Now let's look at this here. These are the numbers that I just showed you that are collected from various sites. So Moderna, 47 million, Pfizer, 50 million. Again, I did not get a concrete numbers from somewhere. So I'm just, after subtractions, this is what I got. Janssen, not 1 million, about 500,000. Moderna, 47 million by 10th March. So there is some number inaccuracy present here. Effectivities, we know about them. So now if we go to anaphylaxis, so you're seeing here Moderna 85. So Moderna, if I just write here for a second, Moderna had 85 cases, and Pfizer-BioNTech has 170 cases. Now, again, I don't think that the numbers in terms of the vaccine itself are double, meaning Moderna 47, we know 10th March, that is reported. I just showed you that over here. Here, with over 47 million doses, and let me show you the date here as well. The date was somewhere over here, written by Julia Riles on March 11. So pretty recent, 47 million. I did not see such a number for Pfizer. But of course, if the total are 110-11 million, then this number cannot be 100 million. But still, this number is almost double on the Pfizer side, anaphylaxis. If you see the Johnson & Johnson, that doesn't show up here. Johnson & Johnson does not show up here. Maybe it is a fewer number of the doses, or maybe Johnson & Johnson is better protective for anaphylaxis. So this is the basic way to look at it. And I'm going to look at some of the concerning things, for example, fever, fatigue, then the facial droop, which may be Bell's palsy, then disability or inability to move body. So let's start these one by one. So I'm going to go here to search, and I say, let's say droop. Search for that. And so now if you see here, facial palsy, facial paralysis, I'm going to take them both. And then eighth nerve paralysis, which is also the same. So I'm going to take all of them. So facial, and this. And then eighth nerve is also related to the face. The remaining things are the same. And if I now go down here, you could actually slice and dice by age, by territory, by date of administration, and then the onset of the symptoms. So there is a lot of ways you can see them. I'm still just looking at the overall numbers. Okay, so these are possibly too many cases. And so what I'm going to do is, let me take these two first, or let me just say all symptoms and see what happens. So here, look at this. Moderna, 13,323. I want to put them down here once again. So Moderna, 13,323, and Pfizer, 17,825, and Johnson & Johnson about 500,000 to 1 million, 2 cases. Now the question is, do they actually go away or do they stay? So it will be, number one, this is a very high number, 13,000, 17,000. Yes, this number is very big as well, but these numbers are significant too. Again, I'm seeing on Pfizer side, the numbers seem to be bigger. It may be that this number is bigger, but I didn't find this number. Okay, so let's look at the, let's do something here. I'm going to take some, let's say just Pfizer, and I'm going to say I want to see the actual description of what people are saying. And then what you do is you click on adverse event description here. This can only be clicked if you choose VAERS ID. Without having VAERS ID, you cannot choose this or it would not show up. And then down here, I'm going to leave this as such. This is fine as well, but here I'm only going to take one vaccine just to show you how. Let's start with Johnson & Johnson, just because it has one case and we can go and read it. And if I say send here, so if you see 13 minutes after the injection, tongue tingling and numbness for 3 hours, hot flashes, feeling hot, headache, and extreme fatigue. So that was the reported incidence. And for 3 hours, which means the person had actually recovered, which is a good thing. So now let's go back and see for, let's say, Pfizer. Pfizer-BioNTech. And they are going to be a lot in number, but let's see if they show us that or not. No, so they're saying it is too large. This request produces 17,000 rows, but 10,000 is the maximum allowed. Simplify this request, send a series of smaller ones, for example, group results by race. So what I'm going to do is I'm actually going to reduce this by number of days. So here it says select vaccination date. So I've taken the whole date. So let's do this. I'm going to select February, for example. So from February, 2020 to March 2021. So that is the vaccination date. So now keep in mind that overall there are 17,000, but I wanted to see what kind of messages people are reporting, what are they experiencing. So here, chest tightness, shortness of breath, then went to throat, sore throat, hoarseness. Patient received EpiPen, 0.3 milligram, 3 doses, 5 minutes apart. Then went to ER, had 2 breathing treatments, albuterol, epinephrine, salmeterol, 1 injection, 50 milligram Benadryl. Report rash at IV site from Benadryl, no rash anywhere else. Prednisolone tapering dose and Benadryl 50 milligram at night and 25 milligram during the day to follow up with the PMD headache. Took nap at 4 p.m., woke at 6 p.m. with one of the worst headaches I've ever had. There is one tenderness at side of left arm. So again, we were looking for facial paralysis, but this is how people have put their messages out. Patient received immunization from vial containing diluent in the amount of 1 rather than 1.8 milliliter of O9 sodium chloride. So dose was concentrated. So they kind of gave an extra dose, more dose. So let me go back and look at the anaphylaxis and their reports. Again, for me, this is concerning that the number of cases for facial droop, or here what we are seeing, palsy, 17,000 in case of Pfizer, and then 13,000 in case of Moderna. Again, yes, out of 50 million each, maybe it is a smaller number, but it is still a larger number. What made me slightly comfortable was that these resolved. So these did not become permanent, but I want to search with you the permanent disabilities too. So first I'm going to look at anaphylaxis itself and just look at how people are reporting it. We looked at the numbers before, but now we're going to look at how they are reported. So here is the anaphylaxis, and I'm going to choose all vaccines. So let's say here, Pfizer, Moderna, and we saw that Johnson & Johnson didn't have it, but I'm going to select it anyways. And then here, select report completed. Let's see the vaccine date, vaccination date. It is still February. So I'm going to remove it to say before 1980, just to go maybe in the beginning and see if they would show us this. So anaphylaxis now. Moderna. So we saw that Moderna had, Pfizer had more. Anaphylaxis angioedema. Angioedema means edema, vascular edema. Patient was given EpiPen 0.3 milligram, IM methylprednisolone 125 milligram, diphenhydramine, IV push 1, famotidine 20 milligram, and so on. Anaphylaxis, EpiPen treatment. Patient developed anaphylaxis, was given IM Benadryl. So these are, so VAERS data and Wonder are updated every Friday, hence results for the same query can change from week to week. These results are for 254 total events. So that is these events. I want to look at the comments here just to make sure that is this something that you are looking at, and is there something that you would like to see specifically? So Japan says, hi everyone, and Dr. Bean and Luffy, Japanese government changed about vaccine and criteria for COVID-19, not duty but free like influenza. Mass Moderna does not say this. I think President Trump win. So interesting. Roman, that is correct. CDC site is, I deliberately actually wanted to go there and show folks how to work with it, just so that when they want to see it, they can actually know their way around, because it just throws a tantrum every so often. So Defimil says, wife has had 2 ICU patients with severe and unexplained neuralgia. So let's look at that as well. John Ray says, I am here for Luffy. Dr. Bean is a plus. Thank you very much. Luffy's today still sitting upstairs. So he spends most of the time in my room. So he was sleeping on the chair there. Zigzag says, France. Okay, so there's a comment to France. Zigzag, hopefully you would stay happy and healthy. And let's just, so Nikki says, I had my first dose Pfizer vaccine on 1, so January 14, and tested positive for COVID on 15. I'm a nurse. I have a long COVID. It's been over 8 weeks and I still have symptoms, mostly neuro issues with daily low-grade fever. Nikki, so what I was seeing yesterday, that fluvoxamine plus ivermectin had been helping. So this was Dr. Syed Heather who reported it. Have you talked with your doctor for a similar protocol? Okay, so I'm going to go back to the to this reporting system just so that we can see what is going on. So I want to see now deaths. So sorry, these are all kind of serious things over here, but I think we should look at it. So I'm going to remove VAERS ID so that we can see the total. And I'm going to remove adverse event description. Then I will come in here and say death and search. Once I've searched, if you see here, there are many causes and forms of death. For example, accidental death, agonal death, apparent life-threatening event, brain death, and so on. I don't know out of these which one, or which the whole group, which is really related to the vaccine. So that is the disclaimer before. I'm just going to leave it as all. So this means these are going to be the total number of reported deaths in those folks who had received the vaccine, regardless of the cause of the death. So Johnson & Johnson, 2 deaths so far. Moderna, those patients who received Moderna, 13,323. This is the 47 million. Now, what I do not know exactly the breakdown, for example, US has given 110 million, out of which 39 are 2 doses and the remaining are single dose. So what I do not know over here, these 47 million, how many single doses and how many double doses. So because of that, these numbers, please take them with a grain of salt. So Moderna, 47 million, and Moderna, 13,323 deaths. Pfizer, 50 million, and Pfizer, 17,825 deaths. Once again, the Pfizer number is my number. It's not a reported number. So I do not know if it is 60 million or I do not know if it is 40 million. I just did this that 111 million were total. Then I saw on 10th March, Moderna 47 million was reported. Johnson & Johnson 500,000 is reported. I kind of considered it that maybe now it is up to 1 million. And then the remaining is here. That is how I did it. So I may be wrong here. But if you see here, in the case of Pfizer, anyways, the number of deaths, the people who have died all cause, 17,000, which is a larger number. If I go back here and try to further reduce it, for example, let's say sudden cardiac death. The person just suddenly died. Although vaccines should not do this. Normally, if you saw, for example, in the case of Florida, Dr. Idiopathic thrombocytopenic purpura was developed. He never had it before. Then it kept on going for 3 weeks, 3 weeks, I believe, before he passed away. So it's not, sudden cardiac death is not something that is seen with the vaccines. So in the case of Moderna, 3, in case of Pfizer, 2. So that is the number of deaths. Then if we look at more common problems, for example, I have the list over here. For example, let's start with the allergies, or really skin rash, pain, irritation, skin rash, fatigue, fever. These are those early things that many of us may have. So pain. So I wanted to take pain at the site of injection. Ear pain, facial pain. It would probably be arm pain, axillary pain. This could be one of them. Headache, injection site, joint pain, injection site pain, joint pain, injection site pain. I'm going to take headache as well because that is a pain. Neck pain. I'm going to take neuralgia as well, neuromuscular pain as well. Neck pain, just simple pain. I'll take rash, although I want to see rash separately, but I'll take rash here as well. Okay, so then once again, let's see. So in case of Johnson & Johnson, one person had enough pain that they reported it, and you just saw the categories of pain. In case of Moderna, 5,281. In case of Pfizer, 6,287. Once again, it seems like Pfizer were given more in number, Moderna was given less in number. Then I want to see the jaw drops. We saw that. I want to just see the total number, which can be related to, and even before that, we saw the jaw drop. Let's look at the inability to move. So if we go back here, I want to remove them all. So I'm going to reset it first. It's a it's a slightly difficult process to work with this thing. Then I'm going to go back to search, and let's say search result inability to move, and they say no matches. So let's say movement disability. I want to see transverse myalgia. So let's start with tremors. Or we'll do ataxia after this as well. Ataxia is a inability to walk correctly. So tremors. So Johnson & Johnson, 2 cases. Moderna, 13,323. Pfizer, 17,825. And these may be the same numbers as we saw before for the other cases as well. There may be more than one symptoms present in one person. So once again, the difference between these two, 43% versus 57%. And again, it's a shame that I do not have the right number over here, so we could compare their percentages. But if we assume for the time being that they're almost equal in number, then there are much more side effects in Pfizer compared to Moderna. So let's see, after tremors, I want to see ataxia. Ataxia is inability to move or walk correctly. So that could be a symptom of neurological issue. So ataxia here. I'm just going to take ataxia. The other one, cerebellar or cerebral or coordination abnormality. I'll take coordination abnormality as well. Cerebellar ataxia is usually, if somebody has said that, then that means that cerebellum was not functioning correctly. That usually is not an immediate effect of a vaccine. We can look at that, but let's look at coordinational problem and ataxia. So Moderna, 12 cases and Pfizer, 14 cases. I would actually like to see how it was reported, and did the patient recover or not? So I'm going to go here and add VAERS ID and then say adverse event description. So here, for example, Moderna, symptoms: hot and cold body temperature variation, moderate dizziness, so dizziness, alternating temporal frontal headache, so temporal frontal headache and nausea, strange feeling overall, treatment, so that was the time period, remained at vaccination clinic area for 30 minutes, returned to work clinic following injection, symptoms remaining but milder. By 10:15, I do not know what was the start time. All symptoms dissipating, but fatigue setting in, feeling uncoordinated, foggy thinking, difficulty with concentration, mild headache becoming some consistent. Then here is another report, feeling uncoordinated, as if I had a couple of glasses of wine. During checkout after 15 minutes observation, medics ran vitals on patient and made decision to transport patient to ED for further evaluation. Here, 10:45, brain fog, dizziness, shortness of breath. 11:30, so 10:45, 11:30, 45 minutes later, difficulty in swallowing, generalized muscular weakness. Then at 2 p.m., previous plus inability to swallow, thin liquids, dry solid foods, palpitation, heart rate of 1606, myalgia and joint pain in areas previously affected by injuries or tendinitis. And let's see if they recovered. Generalized vertigo throughout the body all day, greater intensity upon standing from sitting position, so that is postural hypotension, loss of coordination, brain fog, speech pattern, spasm in muscles, jaw and eyes, eyesight blurry and out of focus. What we don't have here is the recovery. So look at this one. Patient received the vaccine on 12/21/2020 and shortly after began having headache associated with decreased coordination and ataxia. Patient had an MRI performed at another facility which showed bilateral subdural hematoma and midline shift. That is disturbing. So hematoma and midline shift means that there was blood in the brain, blood bleeding, and midline shift means that brain, there was bleeding on one side enough that it pressed the brain to the other side. So not too much, hopefully, but slightly other. So this is called midline shift. Patient was operated on at another facility for evacuation of subdural hematoma. Post-op hospital course was unremarkable. Patient underwent physical therapy and rehabilitation at Doctor's Memorial and discharge on 125. So what I do not know in this one is it related to vaccine? This may be just a general one, but this is shortly after the vaccine, he began having headache associated with decreased coordination. So patient received the vaccine on 12/21 and shortly after began having headache. So if I am the one who is analyzing it, at least from a clinical point of view, this seems to be by the vaccine. What I do not know is what is the rest of the history. Did they have any bleeding disorders? Were they taking any other drugs? What was going on? Good news is that they rehabilitated. Disoriented and slow in movements, difficulty in getting dressed, difficult in coordination, changes in personality, and not herself. All this after the vaccine, she is not herself. There is one more, brain hemorrhage. Look at this. Brain hemorrhage, inflammation, swelling, dizziness. What is the end of this one? Treatment for the events included terms, nauseum, ibuprofen, Benadryl, based on the current available information, temporal association between the use of the product and other events, causal relationship cannot be excluded. Yes, this is the right thing to say. So whoever wrote this, I'm sure it is their doctor, they are saying that I cannot exclude that this was not because of the vaccine. So patient had vaccine injected at Village Health Facility, experienced ataxic gait for several weeks, brought to office by the family, initial impression, CVA, cardiovascular event, seen at ER, admitted, had myocardial infarction, next day treated immediately with balloon and a stent placement of right coronary artery, underwent bypass coronary because of more severe disease that could not be treated by cardiologist. Patient had vaccine injected at the Village, experienced ataxic gait for several weeks, brought to office by family, initial impression of CVAs. This, I need to see the whole history to see it, but this is what we have here. So here, The impact of this report on the risk-benefit profile of the Pfizer product is evaluated as part of the Pfizer procedures for safety evaluation, including the review and analysis of aggregate data for adverse events. Any safety concern identified as part of this review, as well as appropriate action and response, will be promptly notified to. This seems like a serious thing where Pfizer had to get in here as well. So delirious, hypoxic. So delirious is kind of confused, hypoxic, low oxygen, fever, ataxic, cannot walk correctly, incontinent, urine is not held anymore, confused, chills, HA, anorexia, had no appetite, myalgias, extreme fatigue, slept all day and had no appetite. This is spontaneous report from contactable physician. A 74-year-old male patient received Pfizer-BioNTech via an unspecified route of administration on 15 December at single dose for COVID-19 immunization. Medical history included diabetes mellitus. The patient has no known allergies. The patient's concomitant medications were not reported. He was an ER doctor and the medical director of his hospital. The patient was asymptomatic when he got the vaccine on 15. 3 hours after the vaccine, he began to get chills, HA, anorexia, myalgia, and extreme fatigue. This worsened and he slept all and had no appetite. On 19 December, so 15 is when he got it. 19, he woke up delirious with a fever and was ataxic, hypoxic, incontinent, and confused. So these are signs of neurological toxicity. This worsened and he slept all and, the patient was hospitalized due to the events on 15. The event also caused prolonged hospitalization due to the events. The patient was not diagnosed with COVID prior to vaccination. The patient was tested for COVID via nasal swab post-vaccination with unknown results. Why? The patient did not receive any other vaccine. Maybe they put this report in while the results were not out there yet. The patient did not receive any other vaccine within 4 weeks prior to COVID vaccine. The outcome of the events was not recovered. So this is a Cool Bean had asked this question a few days ago, that why not to give the vaccine together or nearby. This is why. So if, let's say, a patient had received more than one therapies, then we would not know what may have been the cause. Here there is just one. Therapeutic measures were taken as a result of the events as the patient required oxygen, plasma, and remdesivir. The batch lot number for the vaccine was not provided. Sender's comment: a possible causal association between administration of the vaccine and the onset of reported serious events might not be excluded, considering the plausible temporal relationship. So these are some of the. Look at this: sudden slurring of speech, slight mouth droopiness. So did they recover? So once again, if you see here, this is that standard Pfizer's response. This case will be reassessed once additional information becomes available, the impact of the report. And so that seems to be a boilerplate response, they're just putting in all of these cases. Within 1 to 2 days of second COVID vaccine, patient developed ataxic gait, so second. After 7 to 10 days of symptom, she saw her primary care, who referred to the patient to the ER for stroke workup. MRI of the brain with and without gadolinium contrast showed sub-CM lesions. Pan CT scan showed no evidence of malignancy. Lumbar puncture of CSF analysis showed lymphocytic pleocytosis. Complete axonal MRI of the spinal cord, cervical thoracic number shows T2 cord, so thoracic 2 somewhere over here. Signal abnormalities concerning for demyelinating, so that is transverse myelitis here. Overall, highly concerning for COVID mRNA vaccine-induced acute disseminated encephalitis, treatment initiated with glucocorticoids. So this, what I do not know is what is further. So one more, and then I'll come back to the live side. My apologies. I thought that when folks were looking for this, we should look at it and see what's going on there. Treatment under emergency use authorization. He presented 10 days after the first COVID-19 vaccine with progressive neurological deficit with bulbar manifestation. So the brain stem is usually referred to as bulb, part of the brain stem. So bulbar manifestation means there were impact on the brainstem, and the result of that impact are showing. Dysarthria, dysphagia, and bilateral arm weakness. So dysarthria cannot speak, dysphagia cannot eat, or cannot eat correctly, cannot speak correctly. If it was just completely gone, then it would be called no speech and aphasia type things, aphasia. And bilateral arm weakness and incoordination. So bilateral arm weakness means that there is again the nervous system that is bringing nerves down here that has an issue. Transfer from community hospital to tertiary center, where the diagnosis was made of the AIDP. He was intubated at the time in neuro ICU, given steroid and IVIG, but no improvement, and was either will need to have track and peg versus camp, and family honored the patient's wishes and made him CMO. Signs of severe demyelination and AIDP was diagnosed. So let me come back here for a second. So I'm going to stop for a second. I think that there are two things here. One is that we could see at least, I'm being very careful because this is the data that I cannot say what I'm going to say is right or not. It seems to me that Pfizer has more reactions than Moderna. Johnson & Johnson is too early to be able to tell. So that is one. And secondly, there are neurological deficits and severe cases that we are seeing here. I am still not very comfortable with this, that you saw that there is a boilerplate message that we are looking into it and we'll get back and we'll inform the authorities of what we found. But in the news, there is no such updates that are coming in to say, hey, when you're giving this vaccine, this is what may be possible. So if they came back after everybody is vaccinated, then their research would not have added any value. So that is what is concerning to me. Okay, so how would you like to continue? The second part that I think is useful to see this is that now you can, there is the link in the description. You can actually go and research by yourself as well, not just for the COVID, for other cases as well. And there are, if you go to the, let me just show you one more thing which is interesting. And that is, if you look at the form, in the form, you can actually ask for, out of so many other things, look at this, you can ask for a specific manufacturer. You can look at the number of doses when a specific reaction is occurring, even the vaccine batch number. You can look at age, sex. You can look at type of event here, recovered or not, yes or no, you can look at that, and so on. And another thing that is interesting here is that you can actually restrict it to various dates. You can say adverse event soon after the administration of the treatment, or adverse events 10 days after, or 20 days after. Or if you are, let's say, more concerned about what's going to happen after the second dose, how many people are getting, let's say, facial palsy or any neurological symptoms, you can actually go in here and you can say after the second dose, so 2 doses, and then you can search for the adverse events. So it gives us a little bit of a further idea. Again, they say that this does not mean it is caused by the person administering or the vaccine itself, but still you can see that there is a lot of dots what we can connect with it. Cool. So if you're okay, what we'll do is this. Let's stop this one, and we can then do a chit chat as well. I have a rehearsal with Dr. Corey and team tomorrow for the FLCCC's panel, which is day after tomorrow. So after this discussion and chit chat, I'm going to sit down and go over my parts that I have to do. So I'll probably do a chit chat for a smaller period of time, and then we'll go from there. So I hope you're all safe and comfortable. Today's discussion was a little scary, but I wanted to, because many cool beans they were thinking that maybe I'm trying to avoid having this discussion. So I thought it is important for us to not only just see it, but also see how to look it up for yourself as well. So I'm going to stop, and we'll come back and we'll do some chit chat for maybe 5-10 minutes, and then I'll start preparing for FLCC. So thank you very much for being here, for being with me throughout the year. Please like, subscribe, and share. And there are 3 links in the description. One is if you wanted to buy me a coffee. Another is to be a patron. And a 3rd link is if you wanted to just support this work. So thank you very much, and I'll see you in a few minutes.